The modern man has a challenging existence. The demands of everyday life could be such that they can easily overwhelm anyone. When our ability to cope with daily life challenges is pushed to the limit, stress and anxiety develop. In today's session, we'll talk about anxiety. I'm joined by two expert psychiatrists, Dr. Humayun Malik and Dr. Uwais Wadu. Welcome, gentlemen.
Thank you.
My first question to you, Dr. Uwais, what is anxiety?
Thank you, Dr. Waheed, for this question. First of all, I want to thank the MindSpeak team for giving me this opportunity today to talk about anxiety. This is a very important question. Anxiety means worry, means being fearful. And all of us are aware about anxiety because all of us do experience anxiety from time to time. What is important is to make a distinction between general anxiety and anxiety as an illness, or what we call anxiety disorder. So generally anxiety, all of us experience that. Whether kids have an examination, they would feel anxious about it, or maybe our elderly are worried about any physical health illness, they might get anxious about it. Or as adults, we might have some difficult, challenging situation and we might get anxious about it. So anxiety, the day-to-day anxiety is very normal and all of us experience it from time to time. What is important is making distinction between this normal anxiety or general anxiety and anxiety disorders. When we talk about anxiety as an illness or an anxiety disorder, it is the same anxiety when it becomes excessive or is persistent, means does not go away and interferes with our day-to-day functioning. We can then think of this anxiety as an illness or as a disorder.
What are the symptoms of anxiety?
The symptoms of anxiety, to make it a bit simple, I can say the symptoms of anxiety are the mind symptoms and the body symptoms. When I say mind symptoms, as I've already said, being worried is a symptom, being fearful, at times being irritable, or inability to concentrate. These could be some of the mind symptoms linked to anxiety. More people or most people are familiar with the body symptoms of anxiety. What are the body symptoms of anxiety? People get palpitations, people get some breathing issues, people might feel at times a bit dizzy, people might get a bit pale, might have dry mouth, some people might experience jelly legs, some people might experience butterflies in their tummy, and some people might have issues with their bowel movements, some people get diarrhea. So these all are symptoms of anxiety.
Who gets anxiety?
Dr. Waheed, an excellent question. As I have already explained, all of us experience anxiety from time to time, be it the young ones, be it the adults, or even the elderly. So it's across all age groups. Everyone does experience anxiety from time to time. It is even present across genders. So it's not that males only get anxiety or females are only anxious. No, all of us do get anxiety from time to time. The same applies to when I talk about anxiety disorders. Anxiety disorders is also present across age groups and across genders. And what we know is it's about 1 in 10 people generally who get an anxiety disorder in their lifetime. But unfortunately, most of the people don't seek help for their anxiety disorders. So I think it is very important, at least through this medium, to emphasize that anxiety is a very normal thing. But if it's excessive, if it's persistent, and if it's impacting on your daily life, you need to seek help. That would be my message to the audience. Thank you.
Thank you for explaining, Dr. Uwais, what anxiety is and what its symptoms are. Now, My next question is to Dr. Humayun Malik. Dr. Malik, how can we manage anxiety in ourselves or in a loved one?
First of all, thank you very much, Dr. Abdul Wahid, for giving me the opportunity to talk about this very important issue and subject. So the question is what we can do about anxiety. As previously Dr. Owais kindly explained a lot of issues relating to anxiety. First of all, the important thing is that is there any way that we can prevent anxiety coming back in the first place, and secondly, what we can do about anxiety without necessarily resorting to professionals or treatment. In this regard, some of the simple things we can do, for example, lifestyle changes, having a good sleep routine, having time for leisure and exercise activities, speaking with the friends and family, and having good diet, exercise, all those things are important. There are times, that we may experience some stresses in life events, etc. That can also bring anxiety. During this time, it's important to identify some of the people, for example, close friends, family members, dear ones that whom we can trust and we can talk to about our problems. Sometimes just sharing something can also be extremely helpful.
Thank you for your response, Dr. Malik. My final question to you is, how can we treat anxiety disorders?
Now, again, thank you very much for this very important question, because what we do about anxiety, and from that, I mean, as explained by my colleague, Dr. Owais, is that anxiety becomes a disorder when it's persistent and when it causes impairment or disturbance in our day-to-day functioning. So in that, there is a lot of criteria for how we diagnose anxiety disorder. However, when anxiety becomes a disorder, as explained already, there are various ways of treating it. One is what we call talking therapy. In talking therapy, there are several treatments which are considered evidence-based for the treatment of anxiety, but more importantly and well-researched treatment is cognitive behavioral therapy. In cognitive behavioral therapy, this is again, as I said, it's a talking therapy which addresses the ways of thinking and the ways of behavior, the ways of habitual ways of what we do normally when we come across any stressful circumstances. So these ways of thinking and ways of behaviors can be what we call maladaptive, which basically means that they complicate the problems further. So through this therapy, these behaviors and thinking patterns are recognized and modified with the help of experienced psychotherapists, psychologists, or other experts. So there is this talking therapy, which, as I said, is quite evidence-based. So finally, there will be a small group of people who would require medications. However, it's very important to know and note that they have to go to their physician, which could be a family physician, which could be a specialist, who are experienced in prescribing medications.
Thank you very much, everyone. If you like this video, don't forget to subscribe to our channel to watch more such videos in the future.